was a Thursday afternoon when my best friend told me that he was going to put me on his will next to his parents the day before he went into surgery. We've all felt this feeling, the knot in your throat, the hope that things will turn okay, the fear of uncertainty. I was feeling what millions feel every day for the first time in my life when faced with that daunting challenge in healthcare. You see, my best friend, Yuri, brother from another mother, relatively healthy young man, loved sailing, loved surfing, and just a few years earlier, we had started our own technology company in healthcare. But turns out, Yuri was born with a rare but very serious genetic defect. He was born with a hole in his heart. I just want to take a moment, first and foremost, how an incredible thing this is that this was diagnosed in the first place. This genetic defect, that if it's not treated, if it's not found out, leads to death by a heart attack in your mid-40s. I mean, the guy was a dead man walking. He was at his primary care doctor, and she heard a very faint murmur in his heart. And she said, you know what? I feel a lot better. If you just got a CAT scan, a little echo, a little follow-up, it's probably nothing. They diagnosed the hole, immediately scheduled for surgery, and the only reason why he's around today is because of that miracle. It's because of that incredible thing that happens in healthcare today. By the way, the surgery itself is even crazier. The medical device that's actually used to fix this hole is this incredible hand-woven thing inspired by the weaving techniques by the Aboriginal Bolivian woman. It's this beautiful combination of art and science. It looks like this. It's amazing. And healthcare does things like this every single day. You see, we came a long way. Just about 100 years ago, we thought injecting pig's blood to people was a relatively good idea. It's not. And fast forward that to today, we're now genetically engineering pigs to produce human blood to combat blood shortages. That's a freaking miracle. But as healthcare became more competent, it became more complex. And unfortunately, complexity leads to errors. Every year, over 250,000 people die in the United States because of a preventable medical error. And I want to underline preventable. These are things we know not to do. These are things like, we gave you the wrong drug. These are things like, we forgot to wash our hands and you got an infection. These are things like you fell from your bed. And yes, believe it or not, falling from your bed is considered a medical error that hospitals can take real precautions against. You see, in today's healthcare, if it takes a village to raise a child, it takes a whole hospital to make you feel better. You see, my co-founder and I, we've been frequent flyers of healthcare over the past decade. I mean, we've had a front row seat to the seismic changes that are happening to our hospitals. We know what it looks like from the inside. That's why when we found out that he needed the surgery, we spent more time selecting his hospital than we did selecting his surgeon. Now, most people are surprised when I tell them about this because, I mean, of course it matters who does your surgery. And by the way, for some folks, if you live in a rural community, there might just be one hospital that you go to in a 500-mile radius. Of course, I recognize all of that. But for most Americans, we've had unprecedented access to healthcare never before seen in history. And to this date, I'm always blown away by how little choosing happens in healthcare. Healthgrades did this study in 2014, and they wanted to find out what were the biggest factors that people looked into in terms of selecting where they receive care. The number one determining factor is convenience of location. Number two is the friendliness of the office staff. I mean, we care more about things like the marble floors and the soothing fountain and the bedside manners than whether you can die from cardiac arrest during a recovery. And you think I'm kidding you. The same study looked at 33 hospitals in Atlanta and found that one of those hospitals, you were 17 times more likely to die because of a heart attack during your recovery. This is crazy. Now compare that to to the hospital that we chose. We chose University of Chicago Medical Center. They have a complex algorithm running in their electronic medical records to predict days in advance which one of their patients are going to get a heart attack, and they take precautions. You see, U Chicago Medical Center takes patient safety very, very seriously. And as a matter of fact, cardiac arrest was just one of the many factors we looked into before we selected this hospital. But you see, what we did is not all that different than what we all do every day. Which brings me to baby banana toothbrushes. That took a weird turn. But I think there's nothing more special than this baby banana toothbrush to tell us that what really needs to happen more in healthcare. You see, what's amazing about this baby banana toothbrush is that on Amazon, it's been reviewed 5,938 times. People took the time to write how amazing. These are paragraphs, by the way. You gotta go and read this stuff. People, just craziness. But you see, what's incredible about this toothbrush is that it's virtually impossible to choke on it. You see, in the world of baby banana toothbrushes, safety sells. And we have only one thing to thank for enabling this baby toothbrush, and it's you. You made this company what it is today. You chose this toothbrush over others. You see, choice is a superpower. I'm a believer in free markets. I believe that if we select the things that we want to win, the world will be better. But you see, with great power comes great responsibility. If Southwest Airlines crashed 17 times more than United, you would care a little less about the 2 free checked luggages you get on the side. I believe we have to use this superpower. It is my biggest pet peeve today that hospitals don't compete on these metrics. And by the way, all of this data, it's sitting right in front of you. Well, not quite. All of this data is public, but you kind of have to know where to look. This is like buried in the depths of the Center for Medicaid Services or the Agency of Healthcare Research and Quality. This is hard to get to. But you know, because we looked, Yuri had one of the most boring surgeries of all time. It took exactly as long as the surgeon said it would. He recovered in exactly 3 days, and was back in the office the next Monday morning. It was kind of uneventful. But you know what? That's what we want out of healthcare. The story isn't about what could have happened to Yuri. The story is about what we can all do to fix healthcare. So here's what we did. We took all of that hard-to-find data and put it into a super simple website called usahospitalcompare.com. It is not perfect. But you know what? It is a way for you to tell hospitals that you care about this stuff. And if you tell them, if you let them know that you care, if you choose hospitals based on these safety metrics, we will fix healthcare. So don't wait for some complicated reform. Don't wait for some promised legislation that's going to take decades to come. Choose. Choose. And together, we can all fix healthcare. One toothbrush at a time.